This is lobotomy, a not-so-ancient form of brain surgery that was so bright in its inception that its originator, Antonio Egas Moniz, was even awarded the Nobel Prize for Medicine in 1949. Designed to treat psychiatric or neurological disorders such as epilepsy and depression, it involved severing connections in the brain's prefrontal cortex. Unsurprisingly, this didn't work out too well, as connections in the brain are kinda important. Initially, lobotomies became the mainstream procedure in some countries, with their use soaring between the 1940s and 1950s. By 1951, nearly 20,000 lobotomies had been performed in the United States and a similar number in the UK. Fun fact, a significant number of these patients were gay men. However, it's worth noting that about 60% of lobotomy patients were actually women. By the mid-1950s, people began to realize that inserting a spike into the brain and cutting stuff was not a good idea. Consequently, the procedure started to be abandoned, first in the Soviet Union and then across Europe. Following surgery, lobotomy patients often emerged stuporous and inconsistent. Some developed insatiable appetites and gained substantial weight, while others experienced seizures as a post-surgery complication. The outcomes of lobotomies were mixed. Like, to some extent, it did work, but it usually came at a cost. British psychiatrist Maurice Partridge described this cost as reducing the complexity of psychic life, and she had a point. After the operation, patients often exhibited reduced spontaneity, responsiveness, self-awareness, and self-control, replaced by an emotionally blunted personality and restricted intelligence. Now, the operation itself, i.e. the process of putting a stick in your brain and cutting stuff, was also not very safe. Some patients died as a result of the operation, and others later committed suicide. Some were left severely brain damaged, and others were able to leave the hospital. Few were able to return to responsible work. But most people fell in between. Their initial symptoms were mostly gone, but now they were somewhat retarded. The severe negative side effects on personality and independent functioning led Walter Freeman to coin the term surgically induced childhood, which he used to describe the results of lobotomy. He suggested that the operation left patients with an infantile personality and believed that a period of maturation could lead to recovery. In an unpublished memoir, Freeman described a 29-year-old post-lobotomy woman as a smiling, lazy, and satisfactory patient with the personality of an oyster who couldn't remember his name and endlessly poured coffee from an empty pot. When her parents struggled with her behavior, Freeman suggested training her like one would train a puppy, a treat if she's right, and a hit if she's not. But in the subject of lobotomy, it should be mentioned that Freeman was somewhat of a demon and probably performed the most lobotomies of anyone. Over the course of 4 decades, he performed nearly 3,500 operations, all with an ice pick. Eventually, he began performing the operation in his van, which people later called the lobotomobile. At one point, he undertook 25 lobotomies in a single day. Many of his patients never recovered, including Rosemary Kennedy, sister to JFK. Rosemary was described by members of her family as a rebellious child who was prone to violent mood swings while growing up. In November 1941, Rosemary's father took her to see Freeman, who performed the lobotomy right then and there, without her mother's knowledge. Sadly, she never recovered, her mental state reversing to that of a toddler until her death. He performed ice pick lobotomies for all kinds of conditions, including headaches. And of course, there were fatalities. In 1951, one of his patients died when Freeman suddenly stopped to pose for a photo during the procedure. The surgical instrument slipped and went too far into the patient's brain. Many others fell victim to a similar fate at the good doctor's hands. Oh, and he wasn't even a surgeon. In conclusion, lobotomy was a bad idea and belongs in the annals of medical history. Thanks for watching, and if you enjoyed the vid, please leave a like, subscribe, and drop a comment. Hopefully, medicine doesn't go in a similar direction ever again.